We are doing some blood flow restriction training with Dr. Ashley here in the clinic, and this is a really good way to get some added benefit to strengthening the quads early on after post-op ACL without having to load her too much. So we're basically going to pump her blood pressure cuff up to a percentage that occludes the artery in her leg so that the muscle has to work a lot harder with less oxygen. So it pumps it up to a calculated millimeters of mercury or pressure that includes about 80%. And then she's going to do 30 single leg preference squats in a row with no break. So this is really good to get that muscle working super, super hard in a low amount of time. It's a high repetition, low rest period. And we do this at the clinic for a lot of our post-op patients. This could be anywhere from total knees, ACLs. We can do it on the arms. It can be for hamstrings, calves. It's a lot of really good stuff that we can't load people super heavy because we don't have the availability to do like really heavy squats in here like with a squat rack. So we use BFR in those cases to really benefit our patients and really tucker their muscles out. So after she gets that 30, 30, and 20, she is huffing and puffing and that quad is shaky, which is really what we want at the end of the ACL, at the end of the session.